colleague, FDA Commissioner Gottlieb, has suggested that that actually could leave consumers worse off by encouraging drug makers to raise the list prices. Is that something, do you agree with that? Do you think that this best price, these discounts artificially drive list prices higher? And is that something that should be explored for changes?
Sure. You know, I think that the pharmaceutical industry has given us great innovation, not only to the United States, but to the entire world. But innovation really doesn't mean anything if you can't afford your medications. And I think what my colleague Scott is referring to is the whole system of pricing is based on rebates. And it's a convoluted system with the idea of a middleman that's negotiating rebates from the manufacturers. But the manufacturer or the middleman or the PBM is basically negotiating not only with the drug manufacturers, but they're also getting money from plans. And it's just a convoluted system where the middleman is getting money from both sides. And so what we've started to think about is we want to create incentives for manufacturers to lower their list price. And we're, essentially what I think the blueprint talked about is thinking about whether our system should be based on list price instead of these rebates.
What excites you the most in the president's drug proposal? I know that Secretary Azar was asked this question yesterday, and he said that this idea of bringing more Medicare Part B drugs under Part D, to him that was one of the biggest things. But what do you see as like potentially the most significant in helping to reduce drug spending?
Well, first of all, I'm very proud and honored to serve with this team. I think the president's leadership on this issue has been tremendous. As long as I've known him, and every conversation that I've had with him, he always talks about drug pricing. It's a high priority for him. And I think the steps that we're taking and what was outlined in the blueprint is, quite frankly, very historic. No other president has put together a plan like this. There are a lot of different elements in that plan, and they really are structured around a few different areas. The first one is increasing competition. And in the issue that you brought up with the Part B plan and Part D is that a lot of times we don't have competition. You've got some new high-cost drugs, which is why FDA is trying to, increase the time to bring generics and other competitors. So that's one piece, is increasing competition. And we know that within the Medicare program, there are some drugs that are in the Part B program, but the competitor is in Part D. And so we're trying to figure out ways of bringing those programs together, or looking at how we could create some of the things that we've done in Part D and Part B to create an environment of competition. Because when we have competition, that's going to lower prices. And then we're also looking at the area of negotiation. If we create a more competitive environment, we want to give new tools to the PBMs, give them the types of innovative tools that are going on in the private market to negotiate better prices. And then the third area is what we talked about before, is creating incentives for pharmaceutical companies to lower their list prices. And that has to do with looking at the entire rebate system. The whole way the rebate system works is around actually encouraging higher prices, because the higher the list prices, because all of the rebates are based on a percentage of that list price. And so the higher the list price, that means the higher the rebates, there's a higher cut that all the middlemen get. So and then, unfortunately for patients, that means that they're paying more out-of-pocket expenses because their out-of-pocket expenses are based on the list price. So we've got a comprehensive package. There's so many different things that I think we have in the blueprint. But I'm excited because I think it provides a real opportunity to lower prices for all Americans.
One of the criticisms, though, that I've been hearing a lot over the last couple of days is like this is a huge list of ideas, and they would sort of tweak things around the edges, but that there's nothing that's going to directly get at the price of drugs. How do you respond to those criticisms?
Well, first of all, this has been a priority from day one. And so we've already done some things to lower list prices. We made some changes in our hospital program, the 340B program, where we knew that hospitals were getting discounts, but they weren't passing those on to our seniors, essentially overcharging them. We already made that change this year. Seniors are going to save $320 million just this year. We also made some changes to the Part D program so that when generics become available, that our seniors have immediate access to that. They don't have to wait a whole year. And that means that they're going to pay lower prices. So we've already made some changes that seniors are starting to feel that are going to lower prices. And I think what we've outlined in a number of different steps, whether it's the changes to Part D, whether it's addressing the incentives, all of those things are going to work together. It's not going to be a one shot and we're done, but we've been working on it over the past year, and we're going to continue to do that.